My name's Neha Sathe, and I take care of critically ill patients in our intensive care units. One of the most common reasons for being in the ICU is patients who have, acute respiratory failure and need a ventilator. And for patients, a ventilator is like a life-saving treatment. But when you're on it for a long time, it comes with a lot of complications like infections, weakness, injury kind of to the airways, and it contributes a ton of cost to hospitals. And so our goal as a doctor is to try to get people off the ventilator as fast as safely possible. And most people do really well with that. But maybe in about 10 to 25% of people, they'll need the ventilator again. They fail. And those are the people who are at highest risk for dying. So with this project, what we're trying to do is to identify who are those patients at highest risk for failing. And we're trying to provide that information to our docs so that they can, provide the resources they need to make sure that this doesn't happen, or at least to lower the risk.
This work was kindly funded by the Institute for Medical Data Science, which had a set of seed grants, essentially promoting this sort of collaborative work between computing researchers and medical researchers. And along with one of these grants was a kind of collaboration with the eScience Institute, which provided the cloud resources that we needed, such as AWS, primarily S3 for storage, data storage, and EC2 instances for servers to train our models. And so the data that we're working with consists of things like patients' medical history, their prior diagnoses, all of their medication, vital signs, as well as these unstructured free text notes. So we have doctor's notes, we have nursing notes, we have the respiratory therapy notes. All of these different flavors of notes are also within our data. And in our case, we are primarily focused on augmenting that structured electronic health record data with the respiratory therapy notes. And so what we've been able to show is that we can successfully extract many of these qualitative features about the patient's condition from these notes, augment them into our machine learning models, and demonstrate stronger performance in categorizing those higher risk patients from the low risk pool. And now, if we have better characterization of these higher risk patients, we can make sure that when they are extubated, we can bring in, for example, an anesthesiologist or another specialist to monitor them during that process.